Myocardial infarctions, diagnosis and treatment. In our previous lesson, we concluded cardiac hemodynamics. In this lesson, we will take a look at myocardial infarctions. We will consider diagnosis, symptoms and treatment of myocardial infarctions, also known as heart attacks, which are caused by a physical occlusion, such as a clot, plaques, or air blocking a coronary artery. This leads to ischemia of the heart muscle, the myocardium, which can lead to cardiac arrest and eventual death. Myocardial infarctions in diagnosis can be classified into two main sections: STEMI, ST elevation myocardial infarction, and NSTEMI, non-ST elevation myocardial infarction. Myocardial infarctions are most often diagnosed with ECG or electrocardiography. ECG in this context is used to check for ST elevation, a rise in the ST segment. The lead that the elevation is in correlates to where the infarction is located. For example, if there is ST elevation in the inferior leads, 2, 3, and AVF, there is likely an infarction in an inferior coronary artery, usually the dominant right coronary artery, or RCA, in 80% of cases. You may also notice reciprocal ST depression in the inferior lead's electrophysiological opposite, most primarily lead AVL. You may also notice T-wave inversions. In NSTEMI, the coronary artery is only partially occluded, resulting in less myocardial ischemia. On ECG, you may notice ST depression or T-wave inversion/flattening. In both cases of STEMI and NSTEMI, blood tests involving the detection of cardiac biomarkers is also relevant in diagnosis of myocardial infarctions. Troponins are enzymes that are released by ischemic cardiomyocytes and into the bloodstream. A blood sample can be taken to check for an elevated level of troponins. Such a case would indicate myocardial infarction. The symptoms of a myocardial infarction vary, but generally there is angina pectoris, chest pain, and chest discomfort. Pain usually radiates to the scapulae and mandible. There may also be dyspnea, which often results in a reduced SpO2, 90 to 95%. Sweating, nausea and/or vomiting, and lightheadedness may be noted. Other symptoms may be seen as well. Treatment of myocardial infarction varies. The primary treatment for MIs is a process known as a percutaneous coronary intervention, or PCI. This involves inserting a catheter into the occluded artery and inflating a balloon to flatten the plaques. A stent is then placed to avoid occlusions in the future. An invasive method of treating a myocardial infarction is in surgery. A CABG, or coronary artery bypass graft, can be performed. This involves removing a healthy blood vessel, usually from the leg, and grafted into the occluded coronary artery, and entirely bypasses the blockage by going around the infarction with the graft. Medication can also be used to treat MIs. This can involve anticoagulant therapy, such as heparin, which thins the blood, allowing it to potentially pass the infarction, or thrombolytic therapy, which is used to dissolve a blood clot occluding the artery. Nitroglycerine may be used to treat pain caused by myocardial infarctions. Nitroglycerine is a vasodilator. It dilates the blood vessels. This allows more blood to pass, and thereby reduces myocardial ischemia, which reduces angina. Continued lack of blood flow through a coronary artery into the myocardium can lead to extensive ischemia and necrosis. As the myocardium is continued to be starved of oxygen, it becomes necrotic. This also triggers an inflammatory response which further damages the heart's muscles. This necrosis can disrupt electrical signals and can impair the heart's ability to pump blood effectively. This process can lead to cardiac arrest and ultimately death. It is important to note that the terms myocardial infarction or heart attack and the term cardiac arrest are not interchangeable. They are separate disorders with unique pathophysiologies, symptoms, treatment, and diagnosis. Thank you for participating in this SCPF Medical Department educational video.